Can your teeth save your vision? Yeah, you heard me correctly. A rare and remarkable procedure called osteoodontal keratoplasties, or OOKP. It sounds more like a riddle from a dental conference than an eye care milestone, but it actually does work. This gained a lot of attention recently because a blind patient in Canada underwent this procedure and regained their vision. Now, to be clear, this is not FDA approved and it's done on a limited scale worldwide. Now, how does this whole entire thing work? The surgery is performed in 2 stages. First, the surgeon needs to extract the tooth, they reshape it, and drill a tiny hole into the tooth, which will eventually hold an artificial lens, creating a tooth-lens complex. And a tooth is very well suited to hold this artificial lens due to a combination of biological and mechanical properties. Plus, it's highly resistant to degradation and infection compared to synthetic materials, and since it's the patient's own tooth, it's biocompatible, so the risk of rejection and inflammation are much lower. Now here's where it gets more creative. The tooth is then implanted into the soft tissue, either the eyelid or the cheek, and it will remain there for months. It's during this period that the surrounding biological tissues will encompass the tooth with a strong connective tissue. In the second stage of the surgery, both the tooth and the new connective tissue are removed. A tiny artificial lens is placed into the hole that was previously created. It is then transplanted to the surface of the eye, replacing the damaged cornea and ultimately restoring vision. Now, this is not your go-to surgery for everyone that has poor eyesight. It's reserved for patients that have severe corneal damage where a traditional corneal transplant either has failed or is impossible. We typically see this in patients that have chemical burns, autoimmune disease, or significant traumatic injuries. Now, there's one important factor with this surgery. The rest of the eye has to be functional, especially the retina and the optic nerve. Otherwise, no amount of dental magic will bring the vision back. So while most people think brushing and flossing means better dental health, for a select few, it actually could hold the secret to saving your vision.